Hi, I'm here today with Noah Searls, and he's a pharmacist at Holzer Health System. Going to answer some questions today about some diabetes medications. Thank you for talking with us today, Noah.
Thank you, Angela. Glad to be on.
One of the big questions I get from patients is, does the diet matter if they take their medicines?
Good question to get started with before we get into medications, because medications really do take a second seat to diet. Um, in my mind, medications will get you more of a short-term resolution to try to get blood sugar numbers down and things. But in the long-term game, the diet and the exercise is going to be more important. So you can't, uh, you can't, what should I say, use medication to outplay a bad diet. Can't do that. Um, just because I'm taking my metformin or something, I can't just completely slack off on my diet. So
Good advice. And
yeah,
that brings, you mentioned metformin, and that's another question that a lot of patients have is metformin bad? Because they hear a lot of things about metformin in the media, on the news.
yeah, and and honestly, to give a pharmacist perspective on, I would just say any medicine that's been as out as long as metformin has, it's just going to get a bad rap, period. Because if you have something that millions of people have taken, uh, there's going to be things come up along the way. But the fact that metformin's been out for so long and been used in the way that it has, and never come down from first line on the guidelines and things too. So there's a lot to be said about that, about its longevity that's been here for a long time. Um, there's certainly a benefit versus risk with any medicine, and there is some things to be said about metformin. With anything, there comes with certain risks, but uh, the the how often those things happen, and also just how high the risk is, the benefit really outweighs the risk in metformin. um, you do have a chance for side effects like with upset stomach and diarrhea, those things, which can really be kind of alleviated if you switch them to the extended release. Um, so if you're using extended release a tablet rather than the immediate release, your chances of stomach upset and diarrhea, those things go from around 55% all the way down to 10%. So it's a huge drop if you just make that one switch. So those can pretty much be avoided. You do have to watch as far as just dosing metformin correctly. It can lead to uh, some side effects and things that you don't want if the kidneys are impaired. So you do have to watch that. Um, so tailoring that dose and working with your doc there. But overall, um, side effects and those things, the risks are unlikely, and they certainly don't outweigh the benefit. Because the good side of metformin, the reason why it's been on top of the guidelines for so long, is that it's going to drop your A1C by like 1 to 2%. Um, and it's cost effective, so it doesn't take a whole lot to get metformin. And generic been around for a long time. It works several different ways, not just one mechanism, but lowering an A1C by 1 to 2% and being cost effective has led to being at the top of the charts for a while now.
And then as far as other tablets, what are some of the main ones that you like to see as a pharmacist or that patients have had good success with?
Yeah, absolutely. So top of the line, I would say as far as oral tablets go, you have metformin, of course, and then if we can do it for coverage purposes, if insurance can do it, um, I prefer what we call the SGLT2 inhibitors. But common names for those is going to be Jardiance, or empagliflozin, and Farxiga or dapagliflozin. Those names you might have seen on commercials and such. But those ones are good ones. They come with the benefit like metformin does, with the 1 to 2% A1C drop, but also they come with their cardiovascular benefit and how they're starting to be used in things like solely heart failure or solely chronic kidney disease. So I do like those ones. So those are my top two between oral tablets, being metformin and those things like Jardiance and Farxiga. Um, Now I will say there's certainly some that I keep kind of like second tier and just keep in the back of my mind. Um, Cost effective ones are going to be like your glipizide or glimepiride, which are lumped together as what we call the sulfonylureas. They are effective, just like metformin and the Jardiance and Farxiga, but they come with some side effects that are unwanted. So that's why I kind of list them like second tier. And that's going to be like weight gain and low blood sugar. So I'm not a huge fan of the side effects, but they are quite effective and they're cheap. So they can help out that way. Um, Apart from that, occasionally you're going to see like uh, pioglitazone, which is another cost-effective one, and it's cheap, but it's not going to have quite the impact like the others will, um, as well as your what we call the DPP4 inhibitors. So like things like Januvia, Tradjenta, um, certainly ones that can be kind of additive effect, but as far as having that quite of an influence, uh, you're not going to see that big of an A1C drop.
Awesome. And then, of course, the weekly injections have exploded in popularity. Can you talk a little bit about some of those?
Sure, absolutely. Yeah, we see these names all the time. Things like Ozempic and Trulicity, and the newest one being Monjaro. Um, they certainly have their place. They A1C drop on them is doing really well. Monjaro, the newest one out, all the way up to 2.5% drop in A1C. So like they're very effective. There's still that thinking in some folks' minds about, oh, I'm going to an injection. One thing that I counsel on, many times is like, these things aren't insulin, so they're not going to come with those side effects that people think about with insulin. So insulin usually you've got your weight gain and your low blood sugar, and these ones they actually can cause weight loss, which is really nice, and that's how some of them have been marketed um, and really just change of a brand name, and that then they market it for weight loss. So they can cause some weight loss, which can be good in a lot of cases, and their chance of causing too low blood sugar is unlikely because they are basically glucose dependent. So it depends on us actually eating rather than just dropping us right away. If they can be covered, they're good. Again, being brand only can be difficult to get them covered. One other thing that's nice about them too is that they are weekly injections. So folks who have a hard time maybe remembering their once, twice, or even 3 times a day tablets, um, doing once a week can be nice. And maybe you can put that into your routine on Sundays or what have you. Um, but that can go well for people as well. So I like the weekly injections. They do come with some cardiovascular benefit too. But their coverage sometimes can be tough, especially in Appalachia. But if they can be covered and patients are good with doing injections, I like them as well.
And then as far as the daily injections, are they more cost effective or is there anything different about those that would make them better?
That's a good question. So um, these weekly ones, their main mechanism behind how they work is they are slowing down the gut in a way that makes us almost tricks our body to making it think that it's eating and that it's full. Um, and so we won't eat as much and therefore not have as much sugar in our diet and such. But with that said, they can cause some nausea and upset stomach with that, which usually goes away around 4 doses or so. But if someone consistently has that with the weekly doses, with the weekly injections, I mean, they can switch to the daily, which I've had some luck with, switching to things like Victoza, which is once a day, and they're the same family together, but they're once a day, and sometimes can be easier on the stomach. So I like to use them there. And then, of course, your other daily injections are going to be your insulins. So I didn't know if you wanted me to go into those or not, but um, so the insulins, you've got your long acting, your short acting, and those are all about under the principle of we're trying to mimic what our body does on a usual basis, and so trying to mimic our long acting insulin, the little bit that's just sticking around all day as our body uses energy. So those ones you're going to find as your once daily insulins like Lantus or Tujeo, Tresiba, things like that. And then you'll have those ones that are meant mostly for mealtime, when our body has these spikes in insulin to try to help for our food that we're intaking. So those would be like your Humalogs or Novalogs. And insulin as a whole is it's fine to do, but we're trying to mimic that natural flow of insulin in the body.
And one thing, you'd have to check your sugar really regularly with those as well. So if you're limited to 1 or 2 strips a day, those may not be a good choice.
Yeah, absolutely. If you're limited to 1 or 2 strips a day, typically I would start with just like that long acting insulin that's just a one time a day, and you can slowly go up since it is going to have an effect, with blood sugars essentially all day long. So starting with a long acting one would be best there if you're limited, which sometimes we are, to one or twice a day testing. So
And then as a pharmacist, have you had any luck with any of the programs that help people afford medicines, like the Lilly Cares or any of those programs to help people in Appalachia get things covered?
yeah, I have. I think so. Cost effective as a whole, um, when looking at diabetes care in Appalachia, um, one I would say like uh, first utilize the GoodRx, Single Care, those coupon databases that um, may be beneficial. But I say those first because they have, they're so readily available and on a phone, and you can just look it up and see which pharmacy has what cost and what coupon. Those are nice, but they do are they're usually just for our commercial payers and doesn't help out when we're talking about government payers, maybe Medicare, Medicaid, those things. So with that, then you have to go to opportunities for the name that what you're talking about is the patient assistance programs through these manufacturers. And with those, patients work with their provider's office, typically with one of the provider's medical secretaries, and they'll have an application, and they show things like, hey, here's my coverage, here's the medicine that we're wanting, and it's based upon the income of the household. And these manufacturers can provide this medicine for either at a reduced rate or completely covered sometimes. And typically that's on a every 1 to 2 year application base. And I have had some luck with those. Some of them require that the income be at a certain level, and also the patient is spending X amount of percent. Usually it's about 3% of that income on prescription meds for them to get covered. But I have probably in the last year, I'd say I'd have a couple dozen go through those and have success.
Great. So there are some options if you want to try one of these medicines and you don't see a way to afford it.
Yeah.
And then some other medicines that are often prescribed for diabetics that aren't necessarily for lowering sugar are the ACE inhibitors and the statins. Can you talk a little bit about those?
Sure, absolutely. Um, so diabetes really, as far as our deaths with diabetes, it's typically not a cause from diabetes. It's usually a cause from some sort of other cardiovascular problem that's going on. So when we are treating diabetes, we have to keep our mind on these other cardiovascular problems that can come up as well. And so this is where these medicines come in. Statins, of course, been around for a long time, but it's the same thing that I said about metformin. When you've got a medicine that's been around as long as they have, they're going to get some bad reps, but they certainly have the evidence to show that they reduce strokes, they reduce heart attacks, and so your statins are lowering the cholesterol, um, and essentially they're going to provide those benefits to reduce those heart attacks and strokes in patients with diabetes. And so um, we don't want to bring further damage to those blood vessels and things. So if we can lower that cholesterol, by all means, we're going to, and try to reduce those heart attacks and strokes. The ACE inhibitors, or also I'll lump in there the ARBs. Those ones go hand in hand. These ones are more on the side of that diabetes can bring about some kidney damage, and usually you can have some protein in the kidney, which shows that you're having kidney impairment and those things. Essentially, our kidneys and diabetes is overworked, and try to filtering out that blood sugar and things. So when we use ACE inhibitors or ARBs, things like lisinopril or losartan, they're not necessarily for reducing our blood pressure, which is good, but and can be used for that. But it's mostly to actually protect that kidney, reducing the pressure and reducing the protein in the kidney, to actually prolong them and help our kidneys work later on in life as well. So both of those medicines we're using to try to help those other areas that really can cause just as as much of an impact or more than impact than diabetes with these other cardiovascular problems.
Yeah, I think that's very confusing for people because they don't always realize how everything works together. So thank you so much for your explanation.
Yeah.
As a pharmacist, is there anything else that you would like to add that you would think that it would be important for patients with diabetes in this region to be aware of?
No, I mean, I think we've covered, quite a bit here, and I would say that diabetes, if I can just give some encouragement on it, because we are learning so much about it, and there are such a broad realm of medications and whatnot. But I don't think to a patient, I don't think you can become too educated on the matter. So I think it's important to get to some diabetes classes, learn all you can from your provider, um, question your pharmacist as they're filling medicines and ask them about it and learn as much as you can. I think that's an important aspect to know. And kind of more of a practical note as well, that a lot of our folks in Appalachia have always done the finger stick blood sugar meters, and I would be a big advocate for the continuous glucose monitors, things like Dexcom and Libre, if you can get your hands on them. I feel like that is where medicine is leading to, and even the A1C, which is just the average of the blood sugars, if we can actually track them the whole day and see the trend and the variability in them and such, those continuous monitors are really nice, and can make a huge impact. So I'd be an advocate for those as well. But so those continuous monitors and getting as much education as you can on it.
That's great. Thank you so much for speaking with us today. It was a pleasure hearing your perspective.
All right. Thank you very much, Angela.